Africa has many accomplishments in which to take pride and confidence. Progress on many fronts is dramatic, with a new sense of optimism right across the continent. Economic growth is strong, feeding through into increased incomes and better living standards. Foreign investment is pouring in, encouraged by the energy and talent of Africa's people, rising consumer demand and improved standards of government. But if the continent is to make the most of its rich potential, there are many challenges still to overcome. And none is bigger than improving Africa's record on maternal health. A recent study in The Lancet, an authoritative medical journal, showed that in 2008, 8 of the 10 countries with the worst maternal mortality record were in Africa. While Africa has only 14% of the world's population, it accounts for well over half of all maternal deaths worldwide, deaths which are overwhelmingly avoidable. The lack of access to family planning, basic care around childbirth, skilled attendance, health checks and advice in pregnancy are the main reasons for this loss of human lives. The campaign on accelerated reduction of maternal mortality in Africa, CARMMA, was launched in 2009 by the African Union with the support of UNFPA, the United Nations Population Fund. To date, 37 African countries have signed up to CARMMA. CARMMA aims to galvanize political action and forge new partnerships across societies to identify the reasons for maternal deaths and put in place the policies and resources to tackle them. Despite some remarkable results across the continent in the reduction of maternal mortality, over 450 women and girls continue to die in Africa every day from complications in pregnancy or childbirth. A CARMMA high-level event was held at the 20th African Union Summit on January 27, 2013, to avail countries with the chance to recommit to the campaign and share ideas and good practices at the highest level. The high-level event was held under the auspices of the African Union and UNFPA under the theme Reinforcing the Campaign on Accelerated Reduction in Maternal Mortality in Africa. The event discussed progress made by African countries in reducing maternal deaths and proposed strategies to accelerate concrete actions to achieve MDGs 4 and 5, including increased and better use of domestic resources for maternal health, investment in the training of skilled birth attendants, and expanding family planning services, among others. Over 30 heads of state attended the meeting. In the remarks they made at the special event, the leaders made a number of commitments.
We should not allow women to continue dying giving birth. Here on our continent, most women who die giving birth. These are deaths that could be avoided if births were always attended to by skilled health workers and if access to family planning services were guaranteed for everyone.
There is a clear evidence that the socio-economic development of our continent is dependent on the improved health of our women and children.
We are strengthening family planning to reduce unwanted pregnancies because a study conducted by a committee on confidential inquiries into maternal mortality in our country has concluded that teenage pregnancies contribute to 36% of maternal deaths, even though they constitute only 8% of total number of pregnancies.
I wish to use this unique opportunity to call on all of us as African leaders to rededicate ourselves to this important cause of saving the lives of our women and children from preventable diseases. This is the idea at the heart of the AU campaign for acceleration of reduction of maternal mortality in Africa, with the theme, no woman must die while giving life.
Vous savez bien que chaque année, sur notre continent,
170 000 femmes meurent en donnant la vie. 170 000, c'est impressionnant. L'Afrique détient ainsi le taux le plus élevé avec 500 décès maternels pour 100 000 naissances vivantes, ce qui représente 56% du taux de mortalité maternelle mondial.
With a strong leadership and determination, I am convinced that our continent can transform the lives of our women and children. We have the opportunity to act now, and I know we will take the right decisions that will ensure that no woman in Africa dies giving life.
On behalf of women, we give birth as a national duty and as a duty to humanity, because our giving birth ensures the continuation of the human race, and therefore we should not die for that.
The African Union's CARMMA campaign has shown great success. Since it was launched 3 years ago, more than 3,000 countries have joined. I applaud UNFPA for its support, and I thank Dr. Babatunde for his leadership and commitment.
Given the heavy social and economic burden that maternal, newborn and child morbidity and mortality continues to exert on our continent's development, we would need to address these preventable deaths if Africa is to achieve the MDGs and its post-2015 development agenda.
Apart from the high attendance and commitments made, the African heads of state who spoke at the event made financial pledges. The President of Gabon, His Excellency Ali Bongo Ondimba, promised UNFPA $500,000 to support CARMMA.
Il serait dès lors souhaitable que nos États, en s'appropriant cette problématique, ne se limitent pas à figurer parmi les pays bénéficiaires. Ils peuvent et doivent désormais accroître leur contribution au financement du Fonds des Nations Unies pour la population, notre principal partenaire dans la lutte contre la mortalité maternelle. Pour ma part, il me plaît d'annoncer que le Gabon vient d'apporter une contribution d'un montant de $500 000 US au Fonds des Nations Unies pour la population.
The high-level event was not just a celebration of the success Africa has achieved so far in accelerating maternal death, but more important, it reinforces actions to implementation.
As you've heard, we had so many opportunities to take forward. The Family Planning Summit, the Child Survivor Summit, the Commodities Commission, which is chaired by my president, and the Education First that speaks to the issues of girls' education. So we are going to work with you. We are going to make sure that we accelerate further the reduction of maternal mortality. I want to especially thank President Bongo for the spontaneous donation that is made to UNFPA and for your leadership.
No woman should die while giving life.
We get belle, make we go hospital. Where we get belle, make we go